Welcome to Cat Adoption Team's Kitten Foster Training. We thank you for opening your hearts and homes. Every year we help thousands of homeless moms and kittens in our local area and beyond. As part of the Animal Shelter Alliance of Portland, we work to reduce euthanasia rates and increase spay-neuter for cats and kittens in our area. We couldn't do this without your help, so again, we thank you. You should have already received a copy of the highs and lows of fostering. We will cover various aspects of this throughout training, so we won't read through them all now. It is important to know that fostering can be challenging at times, that you should be prepared for messy kittens and illness, but that the reward of seeing them grow, get healthy, and move on to their adoptive homes makes it all worthwhile. Who goes to foster care? Orphan kittens 4 to 8 weeks old without a mom. They are eating on their own, but not old enough yet for spay, neuter, and adoption. Moms with kittens up to 8 weeks old. They are also not old enough for spay, neuter, and adoption. Pregnant cats. We have a specialized training that you will take before fostering a pregnant cat. Kittens under 4 weeks old without a mom that need to be bottle fed. A specialized training is also required before fostering bottle babies. Fearful kittens needing socialization. We have a required specialized training for this as well. Kittens recovering from an upper respiratory infection or another illness. Kittens who are adoptable but just need a break from the shelter. And finally, adult cats who are sick, in need of socialization, or just to clear a space at the shelter for another cat in need. You all received a copy of the Kitten Foster Manual when you signed up. Hopefully the scavenger hunt allowed you to become familiar with all the information available. Please keep this resource handy and refer to it often. More often than not, you will find an answer to your question in this manual. You can use the table of contents to link to various sections, or you can use the find function to search for a particular topic. If you can't find the answer in your manual, your next resource will be your mentor, which we will talk more about in a later slide. You will sign a foster agreement for each foster group you take home. It is important to know what you are signing, so we're going to go through it together. Number 1, you understand CAT's mission and goals. You agree to abide by our foster care guidelines, including keeping foster cats and kittens indoors, following instructions in regards to medical care, housing, and quarantine periods. Number 2, program exceptions and changes can only be authorized by CAT's foster coordinator, operations director, or executive director, although we do ask for and implement your feedback regularly. Number 3, CAT owns all foster cats and kittens. They must be returned to CAT upon request. We reserve the right to terminate the foster relationship if necessary. Number 4, you can adopt your own foster kitten or cat, but you must go through the same process and pay the same fee as anyone else. Foster cats and kittens cannot go to their adoptive home until the adoption process is complete, the cat or kitten has been spayed or neutered, and the adoption fee has been paid. Any foster home transfers must be pre-approved by the foster coordinator. Number 5, you must follow CAT's guidelines for medical care. We have an on-site hospital where most of the vet care will take place. Any visits to an outside veterinarian must be pre-approved through our on-call system and must take place at one of our approved emergency vet clinics. We will not reimburse you for any expenses incurred without prior approval. Number 6, there are risks associated with fostering cats. Anyone who is pregnant or has a suppressed immune system should be aware that a parasite sometimes found in cat feces can cause toxoplasmosis. Cat is not liable for any injury or illness to animals or humans in your home relating to your foster activities. And number 7, if you need to leave town during your foster period, please give us as much notice as possible. We will permanently rehome your foster kittens to another cat foster home. Here are some of the key responsibilities that you will want to remember. Your foster cat and kittens must stay indoors at all times unless they are securely in a carrier to travel to the shelter or an outside vet clinic. Windows and doors of your foster room must remain closed. If you are having trouble heating or cooling your foster room, please reach out to your mentor for advice. Mom cats or fearful kittens can easily push out a screen and escape. In order to keep our cats and your own pets safe, we have strict rules about keeping them separate. They must complete a 14-day quarantine and be free of illness before coming out of the foster room or meeting your resident animals. If you want to introduce your foster kittens to your resident cat, be sure that the kittens have tested negative for feline leukemia and have been vaccinated with FVRCP. Keep in mind that most cats and kittens will not be FELV tested prior to going to foster care. If you would like to introduce your foster kittens to your cat-friendly resident dog, start slowly with a barrier like a baby gate in place. Only allow them to interact if the kittens seem interested and aren't hissing or hiding. Don't allow the dog to chase the kittens and always supervise interactions. Your foster kittens should never share food or a litter box with your resident animals. Visits should be short and supervised. Keep in mind that mom cats are notoriously protective of their kittens and will likely not want to meet your resident animals. Please also be aware that any interaction with your resident animals comes with risk of illness transmission, even after the quarantine period. Many foster parents choose to keep them separate for the duration of foster for this reason. One of the things that makes CAT's foster program great is our mentors. They are experienced foster parents who volunteer to assist newer foster parents. They are your first point of contact with any questions or concerns about your foster cat or kittens or the foster program in general. Our hope is that you and your mentor will become close, that you will communicate often and not just when things aren't going well. Keep in mind that your mentor has a life outside of this volunteer position, including work, family, and social activities. When you call, email, or text, allow them time to get back to you. Try to reach out to them during daytime hours rather than late at night or early in the morning, unless it's urgent. Your mentor will come to your home to vaccinate your kittens and provide basic medical care if the kittens are sick. Vaccine appointments should be made in advance to allow time for scheduling. We also have an on-call system for true emergencies. If your cat or kittens are very sick and you cannot get a hold of your mentor, you can call the on-call lead mentor for advice. Their information is emailed out on Sundays for the week. CAT recommends using a bathroom for fostering if possible. It is the easiest to kitten-proof and the easiest to clean and disinfect between groups. If you're using another room, you will need to cover any carpet or furniture for the first 2 weeks of quarantine. You may also consider using a playpen or Tespo panels as your quarantine space. We do have playpens we can loan you. Tespo panels can be purchased online. Let us know if this interests you. Please do not use occupied rooms, laundry rooms, offices, or garages as your foster room. It is not possible to make these rooms kitten safe. Kittens will chew on cords, crawl into small, inaccessible places, and injure themselves knocking over heavy objects. If you are unsure what space will work best in your home, reach out to your mentor for assistance. Once you have chosen your foster room, you will need to kitten-proof it. Remove any non-cat items. Clear the counters of all knickknacks and the bathtub of all sharp or heavy objects that could injure a kitten. Get on the floor, look around, and make sure there aren't any holes or hiding spots a kitten could get into. Remove all electrical cords. If you need to keep a space heater, place it up high or cover the cord with plastic tubing. Your foster room only needs bedding, food bowls, water bowls, litter boxes, and toys. Kittens can be very messy, so old blankets or bedding is best. Your foster bag is full of medical supplies and should never be kept in your foster room. There are too many unsafe, expensive items in there that the kitten should not have access to. It's important to have a good litter box set up so your kittens will use it appropriately. Kittens will intuitively use a litter box when they reach a certain age, but it is your job to make sure it is accessible and clean. Young kittens need short-sided boxes so they can get easily in and out. The wet food boxes we provide you with make great litter boxes, as do cheap cookie sheets or baking pans. If you have multiple kittens, you may need to put out 2 or 3 litter boxes. Place them in the corners of your foster room, as this is where they tend to want to use them. If you find a kitten pottying outside the box, put the litter box in that spot. Mom cats will need their own larger litter box, as the kitten one will be too small for them. We provide you with yesterday's news paper pellet litter. It is kitten safe, and most moms and cats and kittens will use it without issue. Please do not use clump and clay litter for kittens under 8 weeks old. Kittens love to put anything and everything into their mouths, and it can be very dangerous if ingested. Please scoop or dump your litter boxes at least twice daily. Kittens poop a lot, and they don't want to use a dirty litter box. Help them maintain good habits by keeping it nice and clean. You shouldn't have to spend too much money on your foster kittens. We provide you with food, litter, medical supplies, and veterinary care. If needed, we can also help you with litter boxes, toys, and scratchers. Just ask. Although you are welcome to buy expensive cat toys, a crumpled up piece of paper or an old shoestring make wonderfully cheap toys that kittens will love. Old toilet paper rolls can be fashioned into fun items, and old t-shirts can be made into kitten tents. Everyone knows an empty cardboard box is a cat's favorite. Just cut some holes in the sides and they will play for hours. Whatever you decide to use, it should be either thrown out after your kittens get adopted or something you can run through your dishwasher or washing machine. We don't want to share any germs with the next group. The same goes for cat scratchers. It would be great to have a big cat tree for your foster kittens, but those are impossible to clean and disinfect between groups. Stick to the cardboard scratchers and send them along with the kitten at adoption time. CAT is a nonprofit 501c3 organization. That means you can save your receipts and keep track of your mileage for a tax deduction. During the onboarding process, we will sign you up for our Foster Families Google group. This is the primary way that we will communicate with you about cats and kittens needing foster, weekly preventative care due, and program and policy updates. Please be sure that all emails are going to your inbox and being read in a timely manner. This is not a chat group. You can reply to these emails to reach the sender, but you cannot email the whole group. We do have a Facebook group for the purpose of socializing and communicating with your fellow foster parents. We will send an email to the group when new cats or kittens are added to the foster request list. For the most part, it is first come, first serve, so it is helpful if you check your email often. That being said, we do try to prioritize easy kittens for new foster parents. We can also put you on our wait list for an easy group to start with. When you get these emails, click the link to see the foster request list, then reply to the email to request the group you want. If you are open to multiple groups, list them in order of preference. Please note the arrival date. In general, we would like kittens under 6 weeks old to go into foster care the same day they arrive. Pickups are usually 4 to 6 p.m. that day. It is okay for older kittens to stay overnight if needed. Be sure to read all the information for the groups you're interested in. Some of them will require specialized training. In general, kittens will be ready to go to their adoptive homes by about 8 weeks old. When offering to foster a group, be sure to consider any vacation plans. A pregnant cat will require 8 to 10 weeks of foster care. A mom with 2-week-old kittens will need approximately 6 weeks of foster care. Be sure to leave a little wiggle room for kittens that don't make surgery wait on time or get sick. During the onboarding process, we will also share our other Google items. The Google Calendar has the weekly on-call lead mentor information and upcoming trainings and events. The Google Drive folder has important reference materials and documents. The Google Map of foster parent locations is a private map for our fosters only. We will ask if you want to be added. It's a great way to get to know your foster neighbors and coordinate trips to the shelter. We also have a Google form for reporting your preventative care and medications. It is linked in many places, so it's easy to find when you need it. You will see it in the foster manual, in the foster department's email signature, and in the foster email autoresponder. We have a Facebook group just for foster families. I highly recommend joining it if you can. It is full of great photos, joyful stories, and helpful people. Many of our foster parents create Instagram accounts just for fostering. It's a great way to promote your kittens for adoption because you can post photos and videos of them throughout their journey. There's a link in the foster manual to all of the cat foster parent accounts. Check it out and follow your fellow fosters. Let us know if you want to start your own foster Instagram so we can add it to the list. Now we are getting to the good part. It's time to pick up your kittens. Make sure that your foster room is set up and ready to go ahead of time. We'll have pre-arranged a pickup day and time with you. When you arrive at the shelter, please drive around to the left side of the building and park at the clinic entrance. Enter through that door and check in at the desk ahead. We will provide you with a foster bag full of supplies, food, litter, and a carrier full of kittens. If you need anything else like a litter box, toys, or scratchers, let us know. When you get them home, set the carrier up in the foster room, open the door, and let the kittens come out on their own. Give them time to settle in. If you have children in the home, you will need to supervise them and teach them how to handle kittens appropriately. They need to learn how to behave calmly and how to hold a kitten gently and securely. Please do not leave children under 10 unattended in your foster room. We will email you all the foster paperwork, including the foster agreement, kennel cards for each cat and kitten, and blank medical records and personality profile sheets. All of our documents are digital and can be filled out on your computer. Please be sure to sign the foster agreement and send it back in a timely manner. You might be wondering whether or not you get to name your kittens. Well, it depends on what you take. If you take orphan kittens, they will have assigned names before you pick up. If you take a mom with kittens, the mom will have an assigned name and the kittens will be her name plus K1, K2, etc. You will name these kittens and let us know your choices by the time adoptions begin. Please choose names that are simple to pronounce and appropriate. Group themes are great. For example, a cheese group could be cheddar, Gouda, brie, etc. Whether named by you or the shelter, please don't change any kittens' names as it can cause confusion when communicating with the shelter. We do occasionally send pregnant cats to foster. They are usually far along in their pregnancy, within 1 to 2 weeks of birth. The birth process can be tricky and is not recommended for first-time foster parents. If you decide you want to try it in the future, we have a specialized training you will watch and the detailed information in the foster manual to review. Most kittens will start to play around 3 weeks old. Their tendency is to attack anything that moves. This makes your hands and feet very likely targets. It is important to redirect kittens to appropriate toys and not encourage them to bite hands or feet. Although cute at 4 weeks old, it is not so cute when they are 10 pounds. Kittens have a critical period of socialization between about 2 and 7 weeks old. It is important to expose them to different people, sounds, handling, etc. during this time. If they don't get enough experiences as a kitten, they might become fearful later in life. Your job is to handle your kittens daily. This is the fun part of fostering. Pet them, hold them, play with them, carry them around, touch their ears and their toes, trim their nails. Have all family members and even friends come to meet them. Play the radio, the TV, run your vacuum, have friends over. You want to get them used to normal household noises. Well-socialized kittens make great adult cats. We mentioned socialization kittens previously. These are kittens that did not get exposed to humans when they were young, and they need specialized training to reduce their fear. If you're interested in doing this, let us know. It is very rewarding to see them come around and start to trust. We feed Purina Pro Plan kibble and canned food. It is a high-quality diet that is provided to us free by Purina. We also have some alternative diets available at the shelter if your kittens are picky eaters. When kittens are just starting to eat solid food at about 4 to 5 weeks old, they need frequent small meals. Start with a quarter can of wet 3 times a day. Always leave dry food out and change it out daily. Same with the water. If you have a mom cat, she will need plenty of dry food, wet food, and water. There's no such thing as an overweight mom cat. Feed her as much as she wants. If you have a litter of kittens, it can be hard to tell if everyone's eating enough. One of your most important jobs is to weigh all of your kittens daily to make sure they are thriving. You may remember from the scavenger hunt that kittens should gain 4 ounces a week on average, or 10 to 20 grams per day. A lack of weight gain or weight loss can be the first sign of illness. Be sure to let your mentor know right away if this happens. We've already mentioned your foster bag a few times. Now we are going to go over the items that are included in the bag. The basic kit includes a scale for weighing your kittens, nail trimmers, a flea comb for grooming, a pair of gloves, baby shampoo, and baby washcloths for cleanup, a variety of syringes for giving medications, a thermometer, lubricant, and rubbing alcohol for taking temperatures when a kitten is sick, Fortiflora, pumpkin, and A&D ointment to treat loose stools, a stool sample container in case you need to provide a sample to the shelter, a bottle of Strongid, which is an oral dewormer, a packet of HydraCare, which is a hydrating supplement, and a laminated quick guide of who to call in various situations with a fecal scoring chart on the back. There will also be a separate bag of items that require mentor approval prior to using. This includes amoxicillin powder, tobramycin eye drops, and Caro syrup. If you are taking home kittens 4 weeks or younger, your bag will also include a bottle feeding kit and a microwavable warming disc. These items are all very expensive. We require that you return your bag to the shelter after your kittens are adopted so we can clean it and use it for the next foster family. In your foster paperwork email, you will get a kennel card for each cat and kitten. The cat's name is at the top. The patient ID, indicated by red arrows, is our internal number for tracking them. You will be asked to record this on the Google form when reporting medications. Don't confuse it with the cat tag, which is the previous shelter's ID. If it says female or male under sex, the cat has not yet been spayed or neutered. If it says FS or MN, they have been fixed. That stands for female spayed or male neutered. If you have look-alike kittens, we will note a distinguishing feature under their marking section. Often we will mark the inside of their ear with a colored Sharpie to tell them apart. Take a look at the vet treatments given section. You will see that this kitten was tested for FELV or feline leukemia and was negative. If you don't see a negative FELV test, remember that they should not interact with your resident cats. Most importantly, you will want to make note of the treatments that are due. You are responsible for making sure your foster cat and kittens get their Strongid dewormer and FERCP vaccine done on time. I recommend putting these dates in your calendar so you don't forget. You may see other treatment due dates as well, such as a rabies vaccine or a Droncid injection. Rabies vaccines are given starting at 16 weeks old and only by a veterinarian. Your mom cat, or any kittens who are old enough, will get it during spay-neuter. The same goes for Droncid. It is used to treat tapeworms and will be given during spay-neuter. These dates are flexible and do not need to be given exactly when listed. This is what the top portion of the medical record sheet looks like. You will fill in the dates given as you go. We only provide you with the first due date for FERCP and Strongid on the kennel card. It is your responsibility to calculate out the future due dates. Strongid is an oral roundworm treatment. It is given to kittens starting at 4 weeks old and every 2 weeks until they come in for spay-neuter. You have this in your foster bag. It is a yellow liquid and the dosing is by weight, 0.1 mLs per pound of kitten. Talk to your mentor before giving it for the first time. You want to make sure you're giving the right amount. It is a very small dose. Mom cats do not need to be given Strongid. FERCP stands for feline viral rhinotracheitis, calicivirus, and panleukopenia. It's the core combination vaccine that all cats get to protect them from common viruses. We start it at 6 weeks old and give it every 3 weeks until they are 18 weeks old. Then it gets boosted annually. Mom cats only need one vaccine, a booster 3 weeks later, and then they are boosted annually as well. It is very important that we give these vaccines on time. This helps protect cats and kittens from common viruses at the shelter. Don't forget to make the appointment with your mentor ahead of time. Use the provided medical record sheet to keep track of these dates. There is also a section below for tracking weights and illness. This medical record sheet gets submitted after they are adopted and becomes a part of their permanent medical record. Take a look at the kitten in the photo. She doesn't look like she feels very well. Her eyes are squinty and goopy. Her nose has goopy and bloody discharge. This is a classic example of an upper respiratory infection, or a URI, and possibly calicivirus. If you see any of these symptoms, let your mentor know right away so we can treat it. A common concern that a newer foster might overlook is fur loss or scabs. It's tempting to think that a scuffle between kittens resulted in a patch of missing fur, but more often it is a sign of ringworm, a fungal infection of the skin. Limping can indicate an injury, but it can also be a sign of calicivirus, which causes pain in the joints. A cuddly kitten may seem really sweet at first, but if they don't ever want to play with their siblings or they tire out really easily, it might be the first sign that something is wrong. Don't ignore these signs, let your mentor know. Diarrhea, upper respiratory infections, and conjunctivitis are very common among young kittens coming from a shelter environment. Expect to see at least one of these while fostering. URI, or upper respiratory infections, are basically a kitty cold. If it is mild with clear sneezes and the kitten is otherwise doing well, we usually just monitor. If the kitten has goopy snot, a fever, or is not wanting to eat, we may start antibiotics, fluids, or supplemental feeding. Again, let your mentor know and they can help guide you. Conjunctivitis is an eye infection, just like pink eye. If it is just clear and weepy, we usually monitor, but if it looks red, swollen, or has goopy discharge, we may start an antibiotic eye drop. Vomiting. A single episode of vomiting is not a huge concern, but repeated vomiting is not normal and needs to be addressed right away, especially in very small kittens. Vomiting and diarrhea combined are a great recipe for dehydration, which can be life-threatening for a small kitten. Try to stay on top of these symptoms and address them right away rather than waiting. We have an entire page in the foster manual dedicated to the diarrhea protocol. Many kittens will arrive to you with some level of loose stool related to stress and diet change. If it persists for more than a day or so or is very liquidy, you will start the diarrhea protocol and contact your mentor. Be sure to feed them a consistent diet. Pumpkin can be added to their wet food to help firm things up. You should have a bag of pumpkin powder or a packet of pumpkin puree in your foster bag. Persistent loose stool in kittens is often caused by parasites. If needed, your mentor will get you medication needed to treat it. We may also ask you to submit a stool sample. Follow the directions in the diarrhea protocol. We want it as fresh as possible with little to no litter. CAT covers all medical expenses for your foster cats and kittens. We have an on-site hospital with veterinarians working Monday through Friday. We offer vet appointments during the week, usually between 10:30 a.m. and 4 p.m. We realize that most foster parents work during the weekdays, so we also offer the option to drop your foster cat or kitten off in the morning and pick them back up that evening. If an urgent issue arises after hours or on the weekend, we have an on-call system in place to get the kitten emergency care if needed. Please do not seek emergency care on your own. We will not reimburse you, and emergency vet bills can be quite expensive. It's a really good idea to look in the foster manual for the list of approved emergency vet clinics to find the one nearest to you. Make sure that you know how to get there and where to park. If a kitten does get sick and requires emergency care, you will want to be prepared. Kittens and their mom cats can be available for pre-adoption as soon as the kittens are 5 weeks old if they meet the minimum weight, health, and behavior criteria. The foster team will be reaching out to you around that time to assess their readiness. If you are fostering older kittens or kittens that have already been altered, we will reach out to you to assess their behavior and health weekly to determine when they are ready for adoption. Pre-adoption is pre-spay-neuter. Interested adopters apply for the cat or kitten online, complete a meet and greet, attend a virtual adoption counseling session, sign a contract, and pay the adoption fee. The cat or kitten does not go home until after spay-neuter. No exceptions. We also don't do holds in foster care. They must be willing to complete this process. Adoption is the same thing, but the kitten is already altered, so you don't need to hold them until spay-neuter. They can go home as soon as the application, meet and greet, AC session, contract, and payment are complete. If you're interested in adopting your foster cat or kitten, you may. This is often called a foster fail, but we like to think of it as a foster success. The same rules apply here. You must complete the pre-adoption or adoption process. You can decide what kind of meet and greet you are willing to do with potential adopters. Some foster parents prefer to do it over video, otherwise known as a virtual meet and greet, while others are more comfortable inviting adopters over to their home. We will ask you your preference and note it in their profile. The meet and greet is mainly an opportunity for the adopter to get to know the cat or kitten. You, as the foster parent, are not meant to screen them or provide any counseling. CAT has a first-come, first-serve adoption policy. We believe that most people can be great cat owners if given the information and tools to succeed. Our two basic requirements are that the cat or kitten stays indoors only and that the adopter agrees not to declaw. The rest of our cat care discussion happens during the adoption counseling or AC session. These sessions are tailored to the adopter and allow for a review of any behavioral or medical concerns specific to the cat. Although we encourage kitten adoption in pairs, we do not require it. We will sometimes bond adult cats and require that they go home together, but most kittens are flexible enough to make new friends in their adoptive home, whether that be with another cat, a dog, or just their human. If you are interested, you can sign up to help review adoption applications for your fosters, or even become an adoption counselor. Our kitten adoption fee is $200. Our teen and adult cat fees vary between free and $150. Adoption fees are listed on the kennel card under the comments section. There is a $20 discount when adopting a pair of kittens. This is actually a really good deal. It costs us quite a bit more to provide all the care kittens need to be prepared for adoption. Adoption fees only offset these costs slightly. Our adoptions include an exam, vaccines, deworming, flea treatment, a microchip, and spay-neuter. Some cats will also have dental work, blood work, or other special medical care included as well. If anyone gives you a hard time about the fee, remind them that if you tried to pay for those items at a vet, it would cost quite a bit more, sometimes up to $400 or $500. Once it's decided that your foster cat or kittens are ready for pre-adoption or adoption, we will ask you to submit your marketing information. We have a team of volunteers that help us upload this information into our database. It's really important that you provide them all the necessary information to do this correctly. Please send one email per cat or kitten, including a short bio, some photos, and even videos if you'd like. Please also fill out and attach the personality profile form. The bio should be honest but positive. If your foster has some challenging medical or behavioral issues, be upfront about them, but also highlight the best aspects of their personality. Photos should be clear, centered around the cat, and free of background clutter. Group shots or photos of the whole family are great too. You don't need to be a professional photographer or have a fancy camera. Your cell phone camera will work fine. The key is taking a lot of photos and catching them while they are sleepy so they aren't moving. Good photos are often the key to enticing adopters to apply. You're also welcome to include a link to your foster Instagram account if you have one. When we start talking about pre-adoption with you, we will also be scheduling a spay-neuter date. Kittens must be at least 6 weeks old, 1.5 pounds, and have a good body condition score and be healthy in order to qualify. Most kittens will not meet this criteria until 7 to 9 weeks of age. We will schedule the spay-neuter date 2 to 3 weeks in advance. We will try to schedule the entire litter and mom cat for the same date. This means all your kittens need to meet the minimum criteria. Some will be a bit behind others, and that is okay. We will schedule a morning drop-off between 7:30 and 8:30 a.m. and an afternoon pickup between 4:30 and 6 p.m. If you would prefer your mom cat or kittens to stay on site for adoption after spay-neuter, that can be arranged ahead of time. Otherwise, you will be responsible for picking them up and sending them to their adoptive home. The night before surgery, you will want to fill out the foster drop-off sheet completely. If you have a mom cat, she will need to be separated overnight and have her food pulled by 10 p.m. Kittens under 4 months can have food overnight, but should not have food after 6 a.m. the morning of surgery. Water is okay to leave out at all times for kittens and adults. Please write the kittens' names on the provided paper collars and place them on the kittens the morning of surgery. This helps the hospital team easily identify them. When you pick up, all cats and kittens will have a single dose of post-op pain meds to be given by the foster parent the day after surgery. If the kitten is pre-adopted, the adopter can opt for a full 3 days of pain medication by paying $10. If you've opted to pick up your fosters after spay-neuter, you will be responsible for sending them home with the adopters. This is the preferred method as it saves staff time and shelter space. It also allows you to do the final send-off of your foster kittens, which many foster parents truly enjoy. We will give you your adoption supplies at spay-neuter pickup or at foster pickup if your kittens are altered. This includes a cardboard carrier, an adopter bag of food, and a free vet certificate. It may also include a rabies certificate if they are old enough. Once you have received the official adoption pickup email from the shelter, you may schedule a time for the adopter to come get their new cat or kitten. We expect adopters to pick up within 24 to 48 hours after their spay-neuter. For altered kittens, that is within 24 to 48 hours of the pickup email. This isn't a strict rule, but a good guideline to make sure that adopters aren't asking you to hold on to a kitten for too long. We want to free up the foster home for the next group. Once your cat and kittens have gone to their adoptive home, please email the remote adoption coordinator to confirm the adoption and email in your completed medical record sheet to the foster team. Congratulations, you did it! This might not be your favorite task, but it's necessary in order to get your next batch of kittens. Get your supplies ready. You'll need a broom, a mop bucket with hot soapy water, and a spray bottle or bucket of bleach water. The bleach water should be 1 part bleach to 32 parts water. You can also use Clorox cleanup with bleach, which doesn't need to be diluted. Please toss anything that cannot be cleaned, like your cardboard scratchers, your paper toys, and your cardboard box houses. Plastic toys and bowls can go in your dishwasher or be hand washed with hot soapy water and soaked in the bleach solution for 10 minutes. Bedding and fabric toys can go in your washer on a hot cycle with bleach added. If you're using a plastic litter box, be sure that it is still in good condition. If you see a lot of grooves at the bottom, toss it. These grooves make it hard to disinfect, and many cat diseases are spread by fecal matter. If the box is still in good shape, scrub it well with hot soapy water and soak in your bleach solution for 10 minutes. Sweep, then scrub every surface of your foster room with hot soapy water. You want to remove any organic material such as food or fecal matter. This means you will need to scrub up your walls a few feet and on your cabinet doors. Wipe it all clean and then spray or mop with your bleach water. All surfaces must remain wet for a full 10 minutes to disinfect properly. If you don't want to use bleach, you can also purchase a product called Rescue. It is more effective than bleach, but it is expensive. If you choose to do this, please reach out to the foster team to find out how to dilute it properly. Please take some time to check out our frequently asked questions section of the foster manual. One of the questions that is not mentioned elsewhere in the manual is, if I find a litter of kittens, can I foster them through CAT? The answer is, it depends. You'll want to send an email to the foster department. We will have you fill out an online admissions form and get you set up with an appointment if they meet our admissions criteria. Thank you so much for joining us, and we look forward to getting you started. If you have any questions after watching this training, please reach out to the foster team at foster@catadoptionteam.org.